John is also experiencing several co-occurring conditions that have a direct impact on his quality of life. John's weight has increased from 95 to 143 kilograms since his diagnosis, and he also says his height has decreased slightly to 5 foot 9 inches. This gives him a body mass index of 46.7, which is in the obese category. In simple terms, the pathology of obesity involves an accumulation of adipose cells. These cells become adipose tissue and house increased lipids, which result in a volume increase of skeletal muscle, organs, and tissues. This enlargement impedes the efficient functioning of the body, eventually putting pressure on cardiac output, blood pressure, and increasing resting energy expenditure. It also results in the creation of additional immune cells in the adipose cells, triggering the release of pro-inflammatory cytokines, meaning the person's body is in a constant state of inflammation. This means the body is under greater stress and cannot operate as it normally would. John's obesity has several consequences for his well-being. He reports that his breathing may be affected by his weight gain. The relationship between obesity and compromised respiration is well established. On a practical level, compromised respiration means that John will not be getting optimal levels of oxygen circulating in his blood, which can lead to fatigue and a lack of energy, both of which are reported by John. This lack of energy is influencing John's willingness to engage in meaningful occupations, such as playing with his daughter or enjoying physical activities, as well as his capacity to perform ADLs and IADLs. Research demonstrates that obesity is a strong causal factor in sleep-disordered breathing. John reports that his sleep is interrupted by a frequent need to urinate and that the quality of his sleep is compromised. There is a strong possibility that John may be experiencing sleep-disordered breathing as a result of his obesity. John reports that he has trouble controlling his eating, indicating that he may be experiencing disordered eating as a co-occurring condition to his PSP. Compulsive eating and other behaviours, John also refers to shopping, is a common side effect of the medication John is on for PSP. This disordered eating is an obvious contributor to John's obesity and therefore has wide-ranging implications for his occupational engagement and activity levels. Another co-occurring condition that John may be experiencing is depression. While he presented an admirably positive outlook in the video, people with PSP often experience depression or other mental health issues, so it's incumbent on clinicians to be alert to this possibility. Further investigation is required to query whether or not John is experiencing depression, as he does exhibit several symptoms associated with the condition, including social isolation, disordered eating, and fatigue. Depression is also a common side effect of obesity. The pathology of depression is not well understood. The condition has wide variance, but most research implicates factors such as psychosocial stress and stress hormones, as well as several neurotransmitters, including serotonin and dopamine. We know that PSP involves the disruption of neurotransmitters. Indeed, recent research suggests targeting those deficits is critical in improving the quality of life for people with PSP. Another co-occurring condition that may be present is anxiety. John has said he's increasingly concerned about going out on social occasions because of his anxiety about his incontinence. This anxiety directly impacts John's social well-being by interfering with his relationships and adversely affecting his mental health. Recent studies demonstrate incontinence has a strong effect on the mental health of both men and women, and this is clearly the case for John. As this issue is likely to become more serious as John's condition progresses, it's vital that we work with him to find a solution to mitigate his anxiety around this. Obviously, the conflating factor here is John's primary diagnosis of PSP, which can also lead to these symptoms. Nevertheless, as clinicians, we would need to keep a close eye on John's mental health and ensure that he's getting appropriate psychological support, particularly as his condition progresses. It's important to note that many of the co-occurring conditions that John is experiencing are clearly linked. John's disordered eating is contributing to his obesity, which in turn is contributing to his mental anxiety and depression. If we can address the mental health issues and medication side effects, this may minimise his disordered eating, which would then reduce his obesity, leading to improved mental health and occupational engagement.